What particular part of dentistry do you like?
From being an undergrad, Cormac and I went through two slightly different routes. I kind of was more interested in oral surgery, in the nitty-gritty part of work. I was very interested in sedation because my father was one of the first sedation dentists in the north of Ireland and taught it in Queen's University. So I naturally fell into that, and maybe I just wanted to do what my father did. My father did a lot of wisdom teeth, oral surgery and sedation, and I wanted to go down that route. And that coincided with, I suppose, with the advent and kind of maturation of implant therapy becoming a mainstream treatment. And I decided to go down that route of mainly kind of more oral surgery and sedation.
How many implants do you do?
A lot at this stage. I've been doing them since 1999. And the day you think, it's like anything in your profession, the day you think you've nailed it is the day you haven't nailed it.
Yeah.
You're always learning for those.
Yeah.
I mean, I'm qualified 22, 23 years now, and you'll still be learning into your 60s.
Has the technology changed in that time? The implant technology changed?
Yes, it has. I mean, technology has changed in terms of coating of implants, being able to load them more quickly, being more patient-driven, so patients can come in, have their implants on the same day and have their teeth fitted. But the same principles of good surgical procedures apply from an orthopedic surgeon to a dental surgeon. When you're working in areas of the maxilla and mandible, they need to be treated with care, and those principles go back 100 years, you know.
Yeah.
So those principles haven't changed. But the technology has changed, and how we finally restore them has changed as well.
Conor, can you just explain I've this phrase "all on four" for
Mm-hmm.
people that wear dentures? Can you just how that actually works? Can you explain that?
It's a technique where patients have usually suffered from periodontal disease, less trauma, and they end up really on having to remove the remaining lower teeth. And typically, the solution after that is to have a full denture. A full denture is loose because you don't get the suction, and you have poor soft tissue control, and it becomes troublesome. Right. So you have the two options then of having an implant supported denture on all in four implants, and your denture is retained, screwed down onto the implant so it's fixed and non-removable. Yeah. There is the second option of having the overdenture with two implants. Now that is a removable overdenture, but it's a lot more stable because it's anchored by two implants.
Does that come out at night?
That comes out at night time.
Right, so it kind of clicks.
It kind of clicks in and clicks out. It just makes a lower denture a lot more stable. Overall, patients want something that is fixed and that is cleansable, and they don't have to worry about it.
And the procedure for that, if I was going to have that?
The most important part is planning any case, so that can take up to a couple of weeks to plan the case. And then you have the avenue that patients would like to go down now of having the teeth extracted and the implants placed on the same day, and with your immediate denture placed on the same day. So you walk in, have your teeth extracted, and have your implants and denture placed on the same day.
When you change somebody's smile or give them a different look or a different smile, and you can see the change, can you just tell me a little bit about that?
Seeing a patient come in from poorly motivated, have been through the system, nowhere else to turn, and being able to bring that patient through a whole sequence of events and get them out the other side after maybe 9 months. And I mean, that's hugely rewarding, functionally and cosmetically, and to see the life changes they have are incredible.
What makes Shield special?
I suppose the legacy is important to us. I suppose you still have to run everything as a business because you don't survive. It's still a vocation, and there's no doubt it's very rewarding. The joy about dentistry is that you get a fix. Patient has a problem. We're pretty simple guys. Patient has a problem, they come in, you're able to work on them. It's a manual thing, as well as a mental academic exercise, and at the end of the day there's a solution, and there's a fix at the end.
Just talk to me a little bit about sedation.
I've been sedating patients now for 22 years, and to this day, as my father still said as well, and my tutors used to say, it's amazing how you have a patient who comes in, and after infusing a drug, after a couple of minutes, how that patient is just transformed. Yeah. And how, at the end of the procedure, how they change back to themselves again. And to have that, it's not a power thing, but to have that kind of that change in a patient, to be able to work with the patient and change their mindset and have them in this great relaxed environment. It's still kind of mind-boggling every time you do it. It's kind of go, wow, this is a wonderful technique.
What makes your practice, what do you believe makes your practice stand out?
Cormac and I together in a partnership, and we have a multidisciplinary approach. We have certain strengths, and I concentrate on my strengths, Cormac concentrates on his strengths, and together then we can give the patient the best quality that they have.